Hi, everyone. Thank you for attending this session. This session this afternoon is called a Gender-Based Violence Settlement Sector Strategy, Working Together Across Canada. And I'm going to be chairing the session today. My name is Erin Whitmore, and I am the Executive Director of the Ending Violence Association of Canada, a national organization that works in partnership with anti-violence organizations and networks across the country toward addressing and ending gender-based violence. And I'm joining the discussion today from the traditional unceded territory of the Algonquin Anishinaabe people. In our session today, we're going to be hearing more about a project that is funded by IRCC, being carried out by a partnership between the YMCA Greater Halifax, Dartmouth, the Ontario Council of Agencies Serving Immigrants, and the Canadian Immigrant Settlement Sector Alliance, and the Ending Violence Association of Canada. And this project aims to bring together the settlement and anti-violence sectors to explore strategies for collaborating across sectors in ways that can better support immigrant, refugee, and newcomer survivors of gender-based violence and their families. So because we are on a tight timeline today, we want to get into the content of the session. I'm going to move right into introducing our panelists. I'll just be providing a brief bio for each of our speakers that you can read more about all the amazing work and accomplishments of each of them in the conference program. So we have four panelists with us today. Kathryn Bates-Kahn is an educator and lifelong learner committed to social justice and human rights. She holds a degree in international development studies and a Bachelor of Education. And she's led multiple programs over the last 20 years for immigrant children and youth. And she's currently leading the YMCA's Gender-Based Violence Project and is focused on the national settlement sector strategy for increasing capacity and collaboration to respond to gender-based violence. Our second panelist, Valérie Auger-Voyer, is the Strategic Engagement Coordinator at the Ending Violence Association of Canada. She previously worked as a counselor for women who experienced violence at a community-based organization in Ottawa, Ontario for over 5 years. And she is also the vice chair of the Ottawa Coalition to End Violence Against Women. Our third panelist, Nina Kondo, is the executive director of Elmwood Community Resource Center, a position she's held since 2014. She serves as a board member for the Manitoba Association of Newcomer Serving Organizations, the Chalmers Neighborhood Renewal Corporation, as well as a co-chair of the Inclusion and Civic Engagement Committee for the Immigration Partnership Winnipeg. And she has worked for many years within the gender-based violence prevention sector, supporting families experiencing domestic violence. And then our fourth panelist is Margarita Pinton-Perez. She is a qualitative researcher and social worker who holds a PhD from the Department of Society and Culture at El Colegio de la Frontera Sur and an MSW from the University of Toronto. Margarita is currently the senior coordinator for the Initiative to End Gender-Based Violence at the Ontario Council of Agencies Serving Immigrants, where she coordinates a collaborative and national project focused on building leadership capacity to address gender-based violence against non-status refugee and immigrant women. So thank you to our panelists for joining us today. So one housekeeping item before we begin, we have reserved about 10 minutes at the end of the session for questions. So if any of you who are listening this afternoon have any questions that come up, I just ask that you type them in the Q&A box that you can see at the top of your screen, and we will attempt to get to as many of the questions that we can at the end of the session. So with that, I am going to turn it over to our speakers today so that we can get started.
Thanks very much, Erin. Really appreciate you introducing us and our project, and also for keeping us on time. So good luck to all of us on that. Welcome to a gender-based violence settlement sector strategy working together across Canada. Our presentation objectives for today. By the end of the hour, you'll have some more information about our project tools and resources, more information about using a trauma and violence-informed lens in our work, about causes of violence and responding to gender-based violence, about working with newcomers, immigrants, and refugees in an intersectional way. And we'll be considering why collaboration is important and talking more about collaboration. And at the end, of course, there'll be questions and answers, as Erin mentioned. So just before we get into the slide presentation, we'll do a bit of an icebreaker. And so I'm wondering if the folks on the workshop could say in the chat where you are joining us from, and we'll take a look at those.
Looks like we have people from Toronto, from Regina, from a Western University in London, Ontario, Kawasa Neighborhood House, the Northwest Territories Literacy Council, from the Calgary Immigrant Women's Association, a couple other people here from Toronto, Victoria, BC, so a cross-country representation. Excellent.
Well, thanks for that. And the other question to open our session is around collaboration. And so the question is, when you think of the word collaboration or the concept of collaboration, what ideas come to mind to get us thinking about collaboration?
So some of the answers to that question that are coming up, Kathryn, is everyone is involved, sharing ideas and capabilities, building relationships, sharing wisdom, skills, and experiences and learning from others, interagency planning, inclusivity, connections, sharing experiences, expertise, resources, bringing ideas together, communication, reciprocity, connection, sharing personal connections and contacts.
Wonderful. Well, thank you everyone for participating in that brief brainstorm. And now I'm going to turn to a bit of information about our project. So with regards to the project background, we're so glad to have the opportunity to create and offer tools and resources developed in our project for organizations working with newcomers, immigrants, and refugees that focus on gender-based violence awareness and interventions. And one of the goals of our project is to build on the current expertise and existing resources across the country. And our GBV settlement sector strategy aims to develop a shared base of knowledge between the settlement and anti-violence sectors so that we can increase our ability to respond to gender-based violence in newcomer, immigrant, and refugee communities. And I really want to thank the project team for putting this presentation together so that we can offer it to you here at P2P. And with regards to a history of our partnership, we know that gender-based violence is a significant social problem in Canada that affects all communities, and that newcomers require awareness and support to help overcome barriers to accessing information and services. We recognize the diverse and intersectional backgrounds of newcomers in Canada, and we appreciate the need for an anti-racist and anti-oppressive approach that welcomes people and offers safe spaces. And so we came together in 2019 with funding from IRCC to look at addressing gender-based violence as it impacts immigrants, newcomers, and refugees. And we started off with a needs assessment, and we found out more about what already exists. And there's so much information and work happening around gender-based violence across the country. So we're looking to expand collaboration and consultation with leaders in the field over the course of the project. And so now I'm going to share a little bit about the activities of the project, not just to explain what the project's done, but also so that you'll know what's available to you in your organizations if you're interested in accessing information that we have. We have a project website, and it contains the results of our activities so far. So I'm sharing them with that angle. So we have an environmental scan about gender-based violence supports across the settlement sector, the results of a national survey where we interviewed settlement and anti-violence workers on their knowledge and experience with gender-based violence interventions and questions and concerns that we have in the sector. We did interviews with 18 experts on gender-based violence, and many of those folks are highlighted in our online course through the videos that they did. And we also published a research bulletin, which is on our project website and explains the results of this environmental scan that we did and the needs assessment. And we did complete 5 different webinars about gender-based violence during COVID-19, and they're housed also on the project website, as is the strategy document that we built collaboratively with other community consultation. And there's a community consultation report there too that explains that process. And so these are the activities of the project so far. And right now there's a course that's happening where people are online in the 6-week course that's free training offered to people who have the time to take it. It's 15 hours. And so we'll be offering that in French in the new year, the French version. So we're really excited about that. And then again in the spring, another English cohort, the 2nd cohort. So looking for feedback and participation in our soft launch that we're in right now. And we're working on a resource for organizations focused on using a safety lens in our policies and protocols, and developing and fostering a staff champion network that we'll be working on also this winter, and designing and piloting a workshop for programming with clients. And so if you'd like to get more involved in our project and receive more information about it, that would be great. You're welcome to email me my contact information. Then of course I share it with the group, and we have a mailing list, and we also have a booth at this presentation. So we'll be doing a bit of a booth update tomorrow. So you're welcome to join us there. And so that's my part all about the project. And thank you so much for your attention and for participating in little icebreakers there in the beginning. And now I'll turn it over to Valerie from the Ending Violence Association of Canada to move more into some content for us.
Hi, everyone. I hope you can hear me well. My name is Valérie Auger-Royer. So the question that I'm answering today is, what does the anti-violence sector want the settlement sector to know about gender-based violence? So I decided to focus my presentation on using a trauma and violence-informed lens, and my part of the presentation is more geared towards frontline workers. So most of you have probably heard of the term trauma-informed approach, but what does it mean to be both trauma and violence-informed? So being trauma and violence informed means being aware of the connection between trauma and violence and their impacts on people's lives. And using this approach allows to minimize the risk of re-victimizing survivors of violence when delivering services. Next slide, please, Kathryn. Okay, so the first step is understanding the causes of gender-based violence. So gender-based violence stems from systems of inequality in broader society. So at the individual level or the micro level within relationships, gender-based violence is actually a manifestation of these broader power dynamics that exist within our society. So that means that women and minorities who have historically held less power within society face higher risks of experiencing gender-based violence. So it's actually about exerting power and control over someone else due to their gender or other related factors. And also the perpetrator is most often known to the victim. So when we talk about violence, it's not only about physical assaults, but it's really a continuum of controlling gestures, words, and actions. So as you can see on the power and control wheel right there on your screen on the left, there's many tactics that can be used to control someone. So within a relationship, abuse is a cyclical, complex web of control that is slowly spun around the victim and that is meant to make them feel stuck and worthless. So this pattern gradually chips away at their self-esteem. And as a result, the survivor may doubt themselves, they may blame themselves, they may not feel, they may fear not being believed, and they may not see a way out of it. So leaving this pattern is not easy. And the average number of times that someone tries to leave an abusive relationship is 5 to 6 times before being successful. So gender-based violence is a widespread problem in Canada. And so chances are that some of the clients that you're serving may have experienced some form of violence in their lives. So the statistics here are from Statistics Canada, and they give you a little bit of a glimpse of the issue in Canada. So 30% of women have experienced sexual assaults. 59% of queer folks have experienced physical or sexual assaults, and 4 in 10 women have experienced some form of intimate partner violence. So when someone discloses that they've experienced violence, the response that they receive is really, really important because it influences the way that they will or won't engage with either your service or even other service providers in the future. So here on the screen, there's a few examples of responses to avoid when someone discloses violence, because these ways are not trauma and violence informed, and they could reinforce harmful myths and stereotypes. So you want to avoid questions such as, why didn't you just leave? Why were you out at night by yourself? Why didn't you fight back? Why was he angry at you? Because questions like these, they feel judgmental and they blame the victim for the violence that was committed against them. So they send the message basically that the worker who's asking these questions doesn't understand the dynamics of power and control that are at play in the situation. So what you do want to do instead is create an environment that's physically and emotionally safe for clients, and so that they feel able to disclose and then discuss what's going on and plan for their safety. So what that looks like, it looks like listening without judgment, believing the survivor and validating them. So for example, a statement like, that must have been hard for you. You want, like we said, you want to avoid interrogating or kind of why type questions. You want to stay calm, avoid strong emotional reactions. And this is one of the most important points. You want to be patient and respect the client's rhythm because they may not be, willing or ready to call the police, and they may also not want to leave the relationship, and that's okay. So you want to reinforce that it's not their fault and that you can't cause someone to abuse you. You want to ask about their safety or express concern about their safety. And you want to provide choices. And that one's really important as well, because sometimes as workers, and I've been there myself, sometimes we have the urge to kind of swoop in and rescue the person. But what happens then is that we're unfortunately replicating kind of dynamics of power and control that they were trying to escape. Maybe not to the same extent, obviously, but what we really want to do is empower the client to make their own decisions and really take control over their own life. So what we want to do instead is connect them to resources and to supports and try to reduce the number of times that a client has to tell their story over and over. So I just want to focus a little bit more on safety planning. So the first step in safety planning is assessing the risk. So assessing basically the level of danger that the person is in. There are tools to do that, and I don't think that you necessarily need to know, the tools because they can be very lengthy and specialized to use. You need a training in order to use them, but what could be important is just knowing some of the risk factors. So here I put an example of 2 of the risk factors. So one of the most important ones is to know that if someone is in an abusive relationship, that the most dangerous time for them is when the relationship is in the process of breaking down and about the 6 months post-separation as well. So that's when safety planning becomes really, really important. As well as in a situation where someone is being stalked. So safety planning is an important part of handling disclosures, but it doesn't need to mean that it has to be scary or that you have to do that, on your own. So here I just want to give some pointers of what a safety plan kind of looks like. So a safety plan has some key components, and really what it is, it's a discussion. It's like a guided discussion, asking questions to the client and brainstorming with them about what the options are that they have. So usually the first question is, if something happens, if you need a place that's safe, where could you go? And the client can find their own answers as well, right? And then giving them tips on what to do if there is a violent incident in the home. And again, there are handouts to help with that as well. You want to plan for the safety of the children, as well as their safety in public or at their workplace. And again, knowing who to call. So just making sure that you connect them with, a hotline, a crisis line, or the number of your local shelter and that kind of thing. So when possible, you want to make sure that you're doing a warm referral. So what that means is just getting to know your local resources, and ideally even, getting to know the name of the person you would be referring the person to. And if you don't know, then you can also offer to call this resource along with the client if they're feeling comfortable. Another way because sometimes even if we know the name of the person we want to refer to, they're not always available. So another way to refer could be using your local kind of hotline or crisis line. So those are usually answered by anti-violence workers, sometimes shelter workers. They're usually 24/7. And you can actually safety plan with the client on the phone right then and there with that worker. So, it's a matter of kind of picking up the phone, putting them on speaker, and having that conversation and doing that plan along with someone who's used to doing them, especially maybe the first few times. So I'm going to add a few of those resources actually in the chat so that you can have access to them if you want to know a little bit more. And so I'm just going to leave you with a quote from Maya Angelou, and which I think really reflects the trauma and violence informed approach. So she says, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." So with that, I'd like to invite Nina to take it from here.
Thank you, Valerie, for leading us into this. There is a question for me that I will start with. What does the anti-violence sector need to know about settlement sector in order to support individuals who are experiencing gender-based violence? So while newcomer women and girls do not report higher rates of gender-based violence, they may be more vulnerable and less likely to report violence because of the complex barriers for accessing services. And some of those barriers include isolation, right? So perpetrator will not allow them to talk to family member or attend school. The lack of that support system may hinder that person to access services and report gender-based violence. There's also impact of racism. There's concerns about racism experience and discrimination from service providers. Oftentimes, these systemic barriers may also impact their accessibility to services, including language and culture barriers, economic dependency, lack of knowledge about community resources or what's available to them. The biggest one is also immigration status concern, especially if those individuals have precarious immigration status. There may be a lot of fear of deportation or loss of their immigration process, fear of stigma from their community. Oftentimes, newcomers have a huge regard to maintain positive reputation and positive image for their community, and they're fearing to bring shame or to bring negative reputation if they come and share that they're experiencing gender-based violence at home. And also the other side of it is also they have fear that their community may not understand them and may not accept them and reject them instead. So that compounds some of the reasons why newcomer may not come forward when they're experiencing gender-based violence. There's also concern for their family in the new community and family members abroad. They will be reluctant to report domestic violence to the police due to their previous negative experience with law enforcement. There's also that lack of awareness and accommodation of cultural differences. In this case, when delivering services to newcomers, some services are not culturally sensitive to the need of the newcomer. There's a fear of not being understood or believed if they disclose incidents of gender-based violence, and the lack of information about laws and legal rights are also compounded for the reason for them not responding or not addressing or not reporting gender-based violence. Intersectionality. With intersectionality, it's a theory developed by Kimberly Crenshaw that explains how multiple forces work together and interact to reinforce conditions of inequality, social exclusion, the roots of violence. And this occurs because they are intersecting forms of oppression. And intersectionality recognizes that every person's identity is made up of multiple categories at once. And the ways a person may experience systemic oppression are affected by the intersection of these identities. So in one sense, one size fits all approach may not work. So we have to look at various identity that this person may have, such as their sex, their gender, education, race, ethnicity. All of those are intersecting identity that one person has. So when we're serving them and creating services or programming, we have to keep that in mind. These intersections will greatly impact not only their vulnerability to gender-based violence, but also their experience and the system's response to them. So for instance, justice system, housing, it may impact how those systems will support that individual. Women and other survivor/victims who are marginalized in multiple ways and who face structural violence by different system of discrimination may have difficulty being believed, may have difficulty accessing support and finding safety, just again, because they don't know the system, they don't know the services available to them. So it's recommended to use an intersectional lens as a framework to help us understand the social location of that person, therefore also effectively provide services that respond to their unique needs. That previously I say one size fits all approach may not work, which is responding to this. So we need to customize and provide services based on that person's need and where they're at. Risk assessment wheel. So this wheel was developed by Elmwood Community Resource Center team. And the wheel is used in multiple areas of our services, but I'll speak to it using the gender-based violence assessment risk. So it's important to understand factors that contribute to risk and the vulnerability associated to gender-based violence when serving newcomer families. By doing that, it's also considering the risk, the safety within the context of social location, and the intersecting systems of power that may impact that individual further to either be further at risk of experiencing more intense gender-based violence or further at risk of not responding or reporting what they're experiencing. And when we're looking at the wheel, it comes from meso, macro, micro level. So not only looking at that individual alone, but looking at the system around that individual, looking at the community around that individual, what's going on when we're assessing those risks. And in order to use this, the safety risk assessment wheel, you have to be trained in it as per Valerie. So being mindful, but I would just give you a few pointers that you can use when you're serving newcomer families. Looking at exploring their gender identity, making sure how they express themselves, exploring risk of calling that individual at home. So if I'm calling you at home and the perpetrator is at home, what should I do? Should I hang up? Should I use a code word? Should I mention that we're calling to give away children activities? So using anything that will reduce suspicion. And and not putting that individual at further risk. Immigration, we talked about immigration being one of the reasons why individuals don't report gender-based violence. We have to look at how they came to the country. Is it a forced migration? Is it a child bride, or any other precarious status that they may have come into the country, and is it at risk? And often when you're asking these questions, it's also for you to ensure that you're checking in and making sure that that process in place. We had an individual who came to us who were sponsored and believed that was sponsored, but when we called immigration to review some of the information that they were asking, they were wondering, and we were informed that their sponsorship was never submitted. So this individual was sitting in Canada with no status, thinking that the status is, or the application is in process. So your role is to ask questions, but also be mindful of how we are asking those questions. Also be mindful, sometimes they may not feel safe enough to share some of these information. So you have to build that relationship and build trust for them to feel comfortable to relate this information. Looking at things like temporary work permit, assessing when is it going to be expired, making sure that that individual understand her employment rights and responsibility in Canada, making sure that if it's working under the ground or under the table, what are the consequences of that? So really informing that individual of the risk and other possibility. What else can they do? What are the other options that they have? When we're looking at other reasons, it's also fear of being deported, right? They may not know that it's not a case. They may not know that the perpetrator are using this to exert power, because in gender-based violence, it's about power and control. So they're using immigration status or application as a way of maintaining that control over that individual. They're worried that they will lose their children. They're worried that Child and Family Services will be involved. And in those cases, it's about educating them, telling them what's their rights, what can they do if it happens, what are the processes to go about it, so they understand when they're making those informed decisions. Assessing their level of risk may also include looking at what's the likelihood of this individual will experience serious body harm or being killed within 24 hours. When you're doing those risk assessment, we have to keep in mind, if that individual is at risk within 24 hours of losing their life or being extremely harmed, we have to collaborate with the individual who's sitting in front of you to create a safety plan, and also contacting emergency services. And in that case also ensuring that they can access safe housing, shelter. And when you're calling shelter, we have to make sure also we have permission to call on their behalf, making sure you do that warm refer that Valerie mentioned before, explaining to the shelter, this is a person that we're going to send to you, this is what they need, what language they may need in order for them to access your services, what other accommodation that they will need in order for them to stay and feel safe enough to trust that services. Things to consider is also ways of which, if there's a physical violence, where are they being hit? Is it a strangulation? Are they being choked? If they are, that's one thing that I always say, if you're being choked or there's strangulation, please let's go see a doctor. So that way there's further medical examination, because there's more complication with that. Are there any weapon in the house? How they hit you, how often they hit you, what part of your body they hit you often. All of those are indication of risk. Looking at addiction factors, what's the perpetrator level and intensity of substance abuse? Does the perpetrator have history of violence? What's their previous encounter with the law? Did the partner ever threaten them or trying to self-harm themselves or kill children? Are there any sexual violence? Often, we have to keep in mind with this one, the belief of dominance and submission. In many many relationship, we will try to make peace by doing what we are being forced to do. And in this case, often it's about education, educating that person that it's rape. And rape can happen within that relationship. Providing as much information and education in a way that is not going to further stigmatize that individual, but instead inviting them to the conversation, remembering that they are experts. They've been keeping themselves safe until when they came to see you. So how can you support them to enhance their safety planning so they can stay safe? If children are involved, there is also that level of risk and decision making to ensure that we're following the process. We have to ensure that if children are involved, what's the level of risk? Are the children, should we collaborate with that person and see if it's a space to move them into a shelter or a safe housing, and perhaps maybe involve Child and Family Services in a collaborative way so they don't feel threatened. Looking at, is it a place where we should perhaps create a code words with the neighbor? If the neighbor, we have a good relationship with the neighbor, is it a place we can send the children out? Oftentimes, women will move from one room to another room to bring the perpetrator away from the children. Sometimes they will move outside of the house so that way the children don't witness the incidents of violence. So asking them, assessing what safety planning, what mechanism they've been using to keep themselves safe and to keep their children safe, and providing them additional support so they can do better or they can keep themselves safe and their children. So with all of that, the impact of gender-based violence on an individual can be profound, and it is very profound, and often have many layers. So when looking at gender-based violence against newcomer, we have to keep that critical look at the various ways in which racism, sexism, other systems of oppression intersect and impact their lives. The wheel allows us to look at every angle of that person, whether it's looking at immigration status, the economic exclusion and poverty. If we look at that individual lens, are they pregnant? What's their literacy level? Are they going to understand the documents that we are using if we need to provide them with documentation to sign? All of that holistically, using that assessment allows you to ensure that whatever services and case care plan you're creating with that women or individuals is looking at every lens that they may overlook. And being aware of those various risk factors that overlap each other and may impact someone's ability for not reaching out for help. Remembering that our role is to empower, it's to educate the individual to make an informed choice and respect their choice. We're quick to save them, but we can't. We have to trust that they will make the decision that is best for them, and we can only be there to support them and encourage them. Continue to build trust through relationship building until they are ready to move forward. However long that will require, continue to do that. If they decide to stay in relationship, then create safety planning for staying in that relationship. If they decide to leave, if leaving the relationship, then provide support, safety plan for now and post-relationship. Keeping in mind that post-relationship is the difficult part of it. With that, that's the end of my part. I will let Margarita to continue. Before Margarita joins us, there's a question: what can we do to end gender-based violence? So I will invite all of us, if we can put on the chat, what action can we all use to end gender-based violence? Thank you.
Thank you, Nina. It looks like folks are starting to maybe answer that question in the chat. So in terms of what comes next, I'm going to be speaking to you a little bit about collaboration. And that really brings home this idea of, I'm here to kind of talk to you a little bit about what our project focused on and what our strategy is about. And so our project really focuses on building a cross-sectoral collaboration. So building a bridge between the settlement sector and the anti-violence sector. And this is really about encouraging sharing of this burden, this responsibility, and the accountability that each of our sectors have in terms of supporting GBV survivors from immigrant and refugee communities. So our strategy and our project really asks, how can we work together to build on these kind of collective strengths among each sector? How can we exchange knowledge and increase capacity? And how is this something that we can take on in a collaborative way? In terms of in our project, which included research, which Kathryn touched upon, we were able to identify some areas of priority for addressing GBV against immigrant and refugee communities, and in particular, these kinds of priorities and activities that lead towards meaningful collaboration and that are also important in order for us to best support GBV survivors. So I want to kind of speak a little bit about these. And so there's a lot of work to be done to prevent GBV. And so this strategy focuses on 5 key priorities, but of course there are more out there, right? But these are the 5 that we were able to identify and discuss. So number 1 being increasing access to accurate, clear, and consistent information and resources for newcomers, immigrants, and refugees about GBV. We see the importance of challenging victim-blaming attitudes and beliefs, but really trying to understand this in the context of and the impact of these kinds of victim-blaming attitudes and beliefs towards immigrant and refugee communities. Enhancing a client-centered and survivor-centered services that recognize the intersectional needs and experiences of newcomers, immigrants, and refugees, which is, you know, what Nina was discussing and talking about, right? These multiple layers. Number 4 is about establishing a common base of knowledge that service providers can use to increase skills, to improve competencies, and incorporate best practices for responding to GBV. And number 5, the priority area, which is that was identified, was engaging men and boys in GBV awareness, education, and allyship strategies. So if we move on to the next slide, I find this is really helpful, and we did hear a little bit about this from Nina as well, but this is about thinking about the different kinds of strengths that each of the sectors has, right? So when we think about these 2 sectors, and some of you might be, I'm not actually sure who's on the call right now, but some of you might be from the settlement sector, some of you might be from the anti-violence sector, but just an awareness of like, what do each of these sectors do, right? What do they provide in terms of supports? And it's important to think, okay, the settlement sector is when we're referring to newcomer, immigrant, refugee serving organizations. You know, the shared goal here is providing support through the settlement process. And this is a process that's long-term, it's dynamic, it's a 2-way process through which ideally immigrants are going to be able to achieve full equality and freedom of participation in society, right? They're able to use their maximum potential. And then in terms of the anti-violence sector, it's a very specific sector. It's referring to organizations that are working collectively to address GBV, gender-based violence in Canada, through direct service, advocacy, education, and research, right? And so it's important to think about how can these 2 sectors be working together? So if we move on to the next slide, Kathryn, and all of what you're seeing on the screen, by the way, it's a part of our courses, it's online, this is content that you can find and that's available, it's meant to be a tool and resource. So when we think about, you know, service providers in the settlement sector or service provider in the anti-violence sector, think about how much we have to know, right? There's so much information, there's so much information to be able to support survivors of GBV, to be able to support the clients that come to our organizations. And it's important to think about, as service providers, as frontline workers, we are often that first point of contact. So it's really essential for both of these sectors to have this kind of knowledge exchange, to have a common base of knowledge when it comes to supporting and addressing GBV, right? Not with the assumption that that frontline worker then becomes a crisis support worker or then becomes, you know, a counselor in this, but just to have some common basis of knowledge and understanding of what the issues are, so that we can have a stronger front to support and do this kind of work, right? So collaboration for us is so key in this, because it really fosters this kind of collective ownership of the process, right? This kind of collective way of ownership of like, we all kind of serve as a resource, we all serve a certain kind of role in supporting this work. So this means that we improve information sharing, we're improving the conversations around the issues that are impacting newcomer and refugee communities related to GBV, and we're also really developing relationships. So working together, and not just in an informal way, because I think we're always often working across these different sectors, but thinking about this as a strategy that can be a little bit more formal in its approach. So looking here on the screen, what we're talking about is, what are some of these like common goals, and what are some of the key approaches that we can draw from each of the sectors? There's a lot of information, and we have a strategy document. Again, we do have a course. But in terms of our thinking around a meaningful collaboration and action, think of this as kind of like establishing certain kinds of terms of reference, or establishing like a certain kind of, okay, we know we're already kind of doing this work, right? As I mentioned, in more informal ways, or through our partnerships that we may have with anti-violence sector organizations and within the settlement sector. But thinking at a national scale and thinking about this more in a formal way, what are things that we can identify that are necessary to lead into those next steps and to be action oriented, right? So something that we talk about in our project is that inherent to the work that we do is collaboration, because our project actually is kind of its own example of this work, because we are members of different anti-violence sector organizations, we are members of settlement sector organizations, right? So we are in this work building this kind of collaboration, and in ways using that as a blueprint to think about moving this work forward more broadly and at a broader level in a larger network, right? So what was important for us in this work as well, and we use it as examples and as a reference, is the importance of having a shared vision, right? Agreeing to what it is that we want to establish as goals, what are some of the outcomes, right? What are the missions and priorities of this collaboration, right? Is the collaboration in terms of strategy as well, right? So those are important things. Establishing transparency of viewpoints, right? So creating also a space where we can have dialogue, where we can have exchange, where we can be learning from each other. And those are things that we're moving towards as well, to hear from other people within anti-violence sector, within the settlement sector. The importance of really building a common knowledge of information and how we share that information, right? So finding consensus among this collaboration is really important as well. Making sure that we're sharing what's most relevant, because you can imagine both these sectors have so much information to share, right? So what's relevant for this kind of collaboration? What's relevant? How best to support survivors of GBV? What should we be learning from each other? And then the next piece is around communicating the ways in which we are able to kind of share these messages, the unique contribution, recognizing and acknowledging the differing kind of what makes our sector distinct, and what are kind of the areas in which we overlap and in which we can work together. So if we don't mind moving on to the next slide. Okay, so in terms of the different kinds of levels and the work that we've done in our strategy, I don't want to go through this whole document with you because there's a lot here to share. But I do really encourage you to check out this document, because it is a place, it's like a conversation starter, right? It's intended for you to start thinking about the ways in which we're identifying these different areas of priority, how we're seeing this, like what does it look like if you're an organizational leader? What would collaboration look like if you're a frontline worker? So all really important questions for us to be thinking about. And as we move forward with this project, it's important for us to be able to outline what are going to be the responsibilities, kind of the roles and responsibilities of each of our sectors and the different members of our sector as well. So the idea here is that we're establishing some clear goals and some strategic actions, and we've organized it across these different priorities that I mentioned. And I really do encourage you to check out this document. And as Kathryn also shared with you already, we do also have a course that's out there that's related to this work, and with future opportunities for us to be more involved and to have more people be a part of this conversation. So, Kathryn, with that, I believe the next piece is the fun part of engaging and having folks that are on the call be a part of the Q&A. So,
thank you, Margarita, very much. And so, yes, we are going to move into the Q&A part of the workshop. But just before we do that, I wanted to thank Margarita and Nina and Valerie and Aaron for working together on the panel, and to you, the audience, for participating, and to offer again that if you're interested in being more involved, or you want to know about the online course that we mentioned or the strategy, we have a project website. It's ngbv.ca. And also, if you're comfortable leaving your contact information in the chat, I'll record it for being on our mailing list, our project mailing list. And also, we have a booth if you want to send a private chat through the exhibition booth here at this conference. That's another way to reach out. And so thanks, everyone, for the presentation.
Great. Thank you, everyone, for that presentation. It was really interesting to get that overview of the project, to hear about the things that both the anti-violence sector and the settlement sector can learn from each other, the strengths that both sectors have to offer to each other, and then to really kind of dig in and think about what we mean by collaboration, something we talk about doing a lot of, but don't always get the chance to really think through how we can formalize that and what that looks like. So we would welcome any questions. Like I said, if you wanted to type them into the Q&A box, that would be great. We do have a question about where we can find the risk assessment wheel online, and I see that there's a response here from the Elmwood Community Resource Center just saying that it's not posted externally, but it will be added to the best practices and toolkits section on the Elmwood website soon. Nina, I don't know if there's anything you wanted to add to that.
So with the assessment risk wheel, there is a training attached to it. That's why it's not public yet. So with that, with this project, it will be hopefully added and published soon.
Great. Thanks, Nina. So there's a question here. Do you have a physical space where this collaborative effort takes place? I work out of the SAFE Center of Peel, and I'm looking for more resources to connect to. So I'm wondering if anyone on the panel wants to kind of speak to that question, and also maybe the importance of having a physical space to connect, and also, maybe what we've learned during the pandemic about how we can find alternative ways to connect and still practice collaboration.
Well, we did get together one time in 2019 as a partnership group in Toronto when we started off, and we had a workshop together that was facilitated. And we also were able to work together to present here in Nova Scotia at the Domestic Violence National Conference in March, just before the pandemic. So I look back on those times really fondly now. So ideally our group would be able to get together in person a couple times a year. This project was always designed to be virtual or through conference calls. And so that really raises the question about place-based programs and services as well. So this is a national project. We get together and talk about different tools and resources, but also we need to know what Margarita is so fond of talking about is community mapping, what's going on in our own communities, what services are available that are local, that are focused on specific issues of your communities. And so that both approaches would be helpful in terms of responding to gender-based violence, knowing what's happening across the country and what are some promising practices, sort of key themes, and all the different approaches and frameworks that we've learned about or presented here, along with what's going on in our own local communities and who are the resource people that we can access there. I think you mentioned it was in Peel. So there would be different women's centers and shelters and different community organizations, I'm sure, in that community, as there are in others across the country. So it's really honoring and recognizing both like the wealth of information and expertise that's available nationally, and then what's going on locally that can be accessed for survivors.
Great, thanks, Kathryn. And so we have another question here, and I'll just open this up to everyone on the panel, whoever feels like they want to provide a response. And so the question is, how can we better support culturally appropriate supports for gender-based violence? I think especially for small groups that are connected to cultural communities, how can we best support them? Does anyone want to answer that question? So we're talking about ways to offer culturally appropriate supports for gender-based violence with small groups that are connected to cultural communities.
I can answer a little bit, and maybe somebody else can jump in as well. It's about responding to that cultural community. What do they need? So doing your own needs assessment first and hearing from the people from that community, looking at representation. Who's providing that service to that community? Is it someone who represents their culture, if possible? Bring it, if it's a small community and there's no capacity, maybe looking at collaborating with other sector or other agency, settlement agency that are doing that service, or anti-violence sector that are doing that service, and bringing that cultural lens into it. So it's really about asking, what do they need? What else can we add into the services that will represent and make them feel connected and culturally welcomed? It's also about simple things as having a space dedicated for prayers. Is simple things of having, like in shelters, we've been talking about how routine for children going to bed, maybe giving them some ways of taking those books and toys in their room, and the parents talking to them and playing with them, adding some toys that represent their own culture, so the kids also can have that identity as well.
Great, thank you, Nina. Does anyone else want to add anything to that?
Maybe I can just add something. So at the community center where I worked, we served everyone. So in some ways it means that it was more general, and in some ways sometimes it was useful, because we had sometimes clients from certain small communities who preferred accessing services outside of their community because they could be easily identified within their own community. For example, if there's only one interpreter in the city who speaks that language, then they might be connected to the same church or that kind of thing. So I think, again, one of the key components is just providing choices. So obviously having those culturally appropriate options available is great, but then also providing choices on top of that so that they can choose what service they want to access.
Okay, great, thank you. And so I see there's a question here about that we would be offering the online course in French, and whether we have any other French resources. So maybe Kathryn, did you want to speak to that, or Valerie?
Well, I could just start by saying that I shared in the chat the document that we do have in French, which is the equivalent of the strategy. So, la stratégie pour l'établissement et la violence fondée sur le genre. So, and the website is available in French as well.
And in terms of the online course, we just completed all of the content and the development of the online platform in Moodle. And so the first cohort is in English. And then the second cohort, it's being developed now in French. And it will be offered, the French version, in the new year in January with a French facilitator to be able to interact with participants. So that's the plan for the course.
Great, thank you. And it looks like we have one more question here. Again, I'll just open this up to everyone. And the question is, how should we navigate different cultural representations of gender-based violence?
I know in our local project in Nova Scotia, one of the ways that we navigate is by really starting off looking at gender-based violence as a social problem that affects everybody, and that it cuts across all cultures, class, backgrounds, education levels, and it can impact people all over the world in different ways. And so that helps to minimize racism when we're looking at specific groups or specific forms of violence, and to hold both things as true, that gender-based violence is a problem that affects people, and it can also affect people very specifically. And so we need to be able to support people where they are with the form of violence that they're experiencing, recognizing that we need to use the approaches that we've explained, and that we need to have some background in those around anti-oppression, anti-racism, feminism, and being grounded in supporting someone in a way that respects them and focuses on their needs and centers on their experience. I don't know if there's any other insight into that question.
Okay, so that looks like that is all the questions, unless anyone who is still here wants to add something else to the Q&A list. It looks like we've had a lot of people, including list their information to find out more about the project and be involved. So that's great. I'm sure Kathryn will be connecting with everyone. Yeah, and I guess I'll just wrap things up then by saying thank you to all of you for presenting today. It was really great to hear about this project and all the work that's been done, and all of the new activities that are going to be unfolding over the upcoming months. And I guess we can close our session a few minutes early today. But thank you to all the attendees. And Kathryn, do you maybe just want to remind people how to get in touch with you if they do have any questions about anything or want to find out more about the project?
Sure. Yep. So my email is also on the project website. I'm at the YMCA of Greater Halifax, Dartmouth, at our community center. So it's kathryn.batescon@halifax.ymca.ca here. And also tomorrow, around this same time, if people aren't eating supper, or you could bring your supper, we'll have our booth presentation. So you're welcome. That's a Zoom event here at P2P, and it's in the exhibit hall. There's a few different organizations that have booths. So you go there into the exhibit hall, and then you would show up at our booth. Today I visited a couple of different sessions. And if you have questions or you want to leave your contact information there, and there's also a private chat in that spot. And if there's questions that I can't answer or need to follow up on, I'm sure the partners on the project would be able to direct me and give some more information about how we could respond to questions that you may have. And so yeah, that's the way to get in touch. And I did notice that someone went to the website and checked on the online course. And yes, the cohort that we're in right now is closed, but we'll have another course offered, the French version, as I explained, in January. And then in the spring, we'll do another one. And one of the advantages with online learning is you can have a lot of different people participate. So we should be able to register quite a lot of people, and we'll be able to share the information about the start date and how you sign up and that sort of thing. It's on the Learn at Work platform. We'll be able to share that information in the early spring so that we can have some new participants join us.
Great. Thank you, Kathryn. And thanks again to everyone for attending. Hope that everyone enjoys the rest of the conference and has a nice afternoon and evening.
Thanks, Erin. Take care, everyone. Bye.